Good morning, and today we will discuss about clinical understanding and some of the case discussion on childhood diarrheas. It will take 2 or 3 classes. We will start today. So first we will start with the basics. Again, once you understand the basics, the things will be very clear later. So what you mean by diarrhea, especially in children? So usually in adults, when we give the definition of the diarrhea, so we says that it is increased frequency of the stool and change in the consistency of the stool, isn't it? Now, this particular definition, that means increased frequency of the stool in 24 hours and also change in the consistency of the stool, the both are considered under the diarrhea definition. Okay, but when you talk about diarrhea in children, especially infants and newborn, this definition will not hold good, because if you see a newborn baby passes about 20 stools per day. This is also normal. 13 to 14 stools, definitely the baby will pass, and even baby pass up to 20 stools and still it is considered as normal. And if you look into the stool also, that will be loose stool, because baby is taking milk which is rich in lactose, which is nothing but sugar. So definitely baby will going to pass the loose stool. So in the adult definition, the 2 points, increased frequency and increased change in the consistency. Both the things are seen in a newborn child or infant. Okay, but still it is not considered as diarrhea. We know that a newborn passing up to 20 stools per day is also not considered as diarrhea, and we know that it is just because of a exaggerated gastrocolic reflex. The question comes when you consider that child is having diarrhea or newborn or infant is having diarrhea. Okay, so therefore increased frequency, altered consistency of the stool, and one more important thing, that is sick child. Okay, so then only we will consider that yes, this is a baby with the or infant with the diarrhea. So therefore the definition of the diarrhea slightly changes when you consider the newborn or infant or early childhood period. So whether the child is happy or sick, that is the most important criteria here. Baby is passing 20 stools per day, and there is also altered consistency there, but still child is playing, child is playful, or baby is playful, active, not sick looking, then it is not considered as diarrhea. So this is one important aspect. Now what do you mean by a sick baby? Okay, that is also important. Sick looking baby. So happy looking baby or active baby and sick looking baby. Okay, so sick looking baby means it is deviation from the normalcy. A baby is not looking normal, is considered as a sick baby. Normally baby is taking the feed and baby is now not taking the feed, maybe a sick baby. Normally baby is not crying so much, but today baby is crying so much, maybe sick baby. Normally baby is not sleeping that much, but today's baby is sleeping more, that may be a sick baby. Okay, normally baby is not irritable, but today baby is more irritable. Okay, again, so change in the behavior of the child, deviation from the normalcy. Baby may be drowsy, baby may be lazy, irritable, less eating, less sleeping. So these are all some of the criteria that we use to understand the sickness of the baby. So in the newborn and infant, it is not the frequency of the stool which is important. It is not even the consistency of the stool which is important, but the sickness of the baby is very important. Sick looking baby is very important when you consider diarrhea. If you look into the children, normally the mother complains that my baby passes 3 to 4 times per day. So you cannot give the medication for the diarrhea because it is quite normal in the children. Okay, even up to the school age period also this is quite normal. There is nothing to worry. What we have to observe is sickness of the child. Okay, so therefore a very common observation when the baby comes to you, you just observe the baby whether it is sick or happy looking. That is a very important criteria. The sickness of the baby, identification of the sick baby or happy baby, that is important in each and every symptom. Okay, so same is also true for the diarrhea. We go to the next slide now. Okay, now localization of the diarrhea is important. Whenever you have got the diarrhea, from actually which part of the body the diarrhea is coming. We know the diarrhea is definitely a disease related to the GIT. Okay, So the actually pathology start from the GIT itself, whatever may be the cause. Okay, there is some disturbance in the GIT, then only the diarrhea starts. Anyhow, so we need to identify now what is exactly the localization of the diarrhea. Now, do you think the diarrhea may be a disease related to the stomach? Very rarely. Okay, so mostly stomach problem always leads to vomiting. Esophageal problems most of the time leads to dysphagia and vomiting. Okay, so diarrhea is predominantly a disease of the intestine, small intestine or large intestine. Okay, but there are some conditions where diarrhea may occur because of the stomach cause, especially in children, and that condition is called as a gastrocolic reflex. So what actually happens in the newborn and infant is, as soon as food enter inside the stomach, okay, suddenly when the food enter into the stomach and stimulate the musculature of the stomach, now the peristalsis start, and as a result the peristalsis is carried forward into the intestine and intestine contraction takes place, and whatever the stool content which is present in the large intestine will be passed out, and most of the time mother appreciate this condition as diarrhea, but actually it is not diarrhea, again a gastrocolic reflex, exaggerated gastrocolic reflex, and we all witness in day-to-day practice, isn't it? Now here actually baby is passing the loose stools, or frequency of the stool may be increased, and what mother complains is, every time when I feed the baby passes the urine, baby passes the stool. Okay, this is a complaint of the mother. So although baby is not so sick looking, but there is increased frequency, and also there is a change in the consistency also, but the cause is surprisingly from the stomach. So most of the time we say stomach may not lead to a case of diarrhea, isn't it? Stomach problems mostly leads to the case of vomiting, but surprisingly here, although the starting point is stomach, you will have diarrhea. So this is another exception. Okay, in case of newborn or infants, we will have stomach as a cause of a loose stool or increased frequency of the stool, and that condition is called as a exaggerated gastrocolic reflex. Okay, so this is one more important thing. Now come to the symptom wise. We have to anatomically locate. See, we find so many cases of diarrhea in day-to-day practice. Okay, but what is important, as soon as mother says this is diarrhea, what is very important is you have to identify from the which part of the GIT this is connected. Mother is telling the diarrhea, whether it is related to the stomach, whether it is related to the duodenum, whether it is related to intestine, whether it is related to the large intestine. If large intestine, is it ascending colon, descending colon, transverse colon, sigmoid colon? Okay, this is called as intelligence of the physician. Okay, so you cannot blindly ask the questions and inquire the patient. Now try to find out where exactly anatomy is there. Once you know the anatomy, then the things are very easy. First you have to decide whether this diarrhea is intestinal origin, stomach origin, large intestinal origin, or something else. Anyway, we will see that. Now we know that esophageal conditions in the GIT very rarely leads to diarrhea, because we know that esophageal conditions in the last class also we have seen, it leads to regurgitation, it leads to vomiting, or sometime it may lead to heartburn like condition, that we know. Now from the stomach there is one cause of the vomiting, especially in the newborn and infants, that is exaggerated gastrocolic reflex. Okay, and if the anatomy is present in the stomach, usually we will have distension of the upper abdomen, or there is epigastrium fullness, etc. will be seen, as in case of pyloric stenosis. So except the one condition of gastrocolic reflex, the stomach is not a very common cause of diarrhea. Now come to the small intestine. This is very important. We know that diarrhea is predominantly a condition related symptomatology which is related to the small intestine and as well as large intestine. Now what is the beauty of a diarrhea starting from the small intestine? This you have to decide. Okay, small intestine contains so many secretions, glands are there, mucus glands are there, digestive enzymes are secreted. Okay, and it is the area where actually villi are present, and so much of absorption takes place, assimilation takes place. Okay, nutrients are get absorbed from the different parts of the small intestine. So basically this is the area where actually whatever food which we have consumed, that has been get absorbed and utilized. So if there is some problem in the intestine, especially small intestine, then these nutrients are not get absorbed and it remains in the stomach. Rather, it remains in the intestine. Okay. So what actually happens is, in case of small intestinal problems, rarely there may be vomiting, as in case of gastroenteritis and all. There will be abdominal pain and there will be large watery diarrhea. This is very important, because if the product of this assimilation and all, that means the nutrients after digestion and all, when they're coming to the intestine villi area for the absorption, if the absorption is not taking place properly, then that particular contents, ahar rasa, will remain in the intestine, it's a small intestine itself, and that passes through. And therefore a large volume of the stool will be formed, because it is mixed by the food substances, ahar rasa, it is with some of the glandular secretions, so much of mucus secretions. So everything mixed together, unabsorbed materials mixed together, and it forms a large volume of the stool. So whenever patient passes a large volume of the stool, definitely this is a diarrhea of small intestinal origin. Very simple. Okay, why the reason is because large amount of nutrients will be there in the intestinal area for the purpose of absorption. If there is a damage to the mucous membrane or some villi, etc., the absorption will not take place, and this particular food contents pass as if through the intestine, enter into large intestine and pass through. So patient passes large amount of the stool. Okay, so this is very, very important. Meantime, there will be also abdominal pain, and if the problem is there in the duodenal area, etc., sometimes there may be vomiting. Otherwise, largely it is diarrhea. I think this is very clear. So small intestine is a place of absorption, therefore place of absorption and also digestion. So much of glandular secretions will be there, many mucus secretions will be there, and nutrients are there which is going through the intestine for the purpose of absorption. When it is not taking place, all these contents pass as if through the large intestine and pass through the rectum, and diarrhea will develop, and that diarrhea is having large volume of the stool. So that's very characteristic feature of a small intestinal diarrhea. Now if it is in the small intestine, we have got two important conditions. Small intestinal diarrhea may be acute, or small intestinal diarrhea may be chronic. And if the small intestinal diarrhea is there, that is acute. For example, some bacterial infection has taken place, some viral infection has taken place, okay, some food intolerance, etc. is there. It's a sudden onset. If it is sudden or acute onset, then patient passes or child passes frequent loose stools. Child will be passing frequent loose stools, watery stools, okay, watery stools, and there will be more loss of the water, etc., and there will be dehydration. Okay, now small intestinal diarrhea means large volume of the stool will be there, and that large volume of the stool is also contains so many electrolytes, okay, water portion, salt, sodium, etc. Many of the electrolytes are also there. So when large amount of the stool along with this fluid and electrolyte passes through as a diarrhea, pass out as diarrhea, so there is also electrolyte imbalance. So therefore, when small intestinal diarrhea is there, if it is acute, like because of some infection and all, usually we will have large amount of the stool, large amount of watery stools, increase the frequency along with the dehydration, because water loss is there. So dehydration is usually a striking features in small intestinal diarrhea where the cause is acute. Now come to another condition, small intestinal diarrhea where the cause is chronic. Small intestinal diarrhea, for example, celiac disease, okay, small intestinal diarrhea, a chronic cause is chronic. Now again, in this condition there will be infrequent stool. Patient is passing increased frequency of the stool. There will be abdominal distension also. But as it is a chronic presentation, since so long time this problem is existing and absorption is not taking place, villi are not working, nutrients are not absorbed. So what happens? Body will badly going to suffer, and you will have a symptoms of malabsorption. So patient present with the symptoms of malabsorption, loss of weight, failure to thrive, along with the increased frequency of the stools, and large amount of the stool is passed. There is passing of large amount of the stool, frequency is increased. It may be sometimes water stools also. Along with that, patient is also having loss of weight, failure to thrive, and malabsorption symptoms, and that is called as chronic small intestinal diarrhea. That is seen in case of chronic small intestinal diarrhea. For example, vitamin D and vitamin A deficiency will be there because of malabsorption, because things are not get absorbed, or iron deficiency will be there. So this malabsorption symptoms also develops, deficiency symptoms also develops. That is seen in case of a chronic intestinal diarrhea. Whenever you say intestinal diarrhea, one thing is very common. There is large amount of the stool will be there. Large amount of water stool will be passing. Frequency increased, consistency changed. If acute, there will be symptoms of more symptoms of dehydration, and if it is chronic, there will be more symptoms of malabsorption and loss of weight and failure to thrive. I think this is clear. But when you come to the large intestine now, suppose a diarrhea is there, the cause is from the large intestine. We know that large intestine is not related to the absorption, except absorption of the water and some of the fatty acids, okay, long chain fatty acids. The large intestine will not perform any other functions, okay. So it is dryness of the, that means it absorbs the excess amount of the water and some of the fatty acids, except that no other function. I think some function is also related to vitamin B12 also, that we will see. Now, therefore, in the large intestine, up to small intestine, everything is normal, and in the large intestine there is a problem because of which diarrhea is there. Then that diarrhea is not a high volume diarrhea, okay, because maximum things are get absorbed in the small intestine itself. So when it comes to the large intestine, only the the excretory portion is remaining, and from that excreta also the large intestine is absorbing the water and retaining it, okay, and make the stool very hard and thick consistency. Therefore, when there is a problem in the large intestine, we don't have any large volume stool. So stool volume is very small, okay. Stool volume is little, only little stool volume is there, or small volume is there. There may be increased frequency of the stool. Yes, that's the definition of diarrhea. Increased frequency of the stool will be there. Now important, when it is large intestine, volume is less, amount formed is low, okay, increased frequency will be there, but it may be mixed with the blood, mucus. It may be mixed with the blood and mucus, and there will be tenesmus, straining will be there, okay. Blood, stool and mucus mixed stool when passed with difficulty, with the pain, okay, with the throbbing, with the squeezing type of pain. So that is called as tenesmus. So tenesmus will be there. There may be abdominal distension, there may be abdominal pain. So this is the basic difference. Large volume stool is always small intestinal stool. Small volume stool is always large intestinal stool, okay. Large intestine stool, most of the time it is related with the scanty stool, blood mixed or mucus mixed. In case of amoebiasis, so it's a large intestinal problem, not in the small intestine, okay. Colitis, different types of colitis, amoebic colitis, bacillary colitis, or what we say bacillary dysentery, amoebic dysentery, okay. So these are all actually related to large intestine. Dysentery means blood mixed stool, okay. So now this is a basic difference. Tenesmus will be there in large intestine, pravahika, what we say pravahika, that will be there in the large intestinal diarrhea, whereas tenesmus is absent in case of small intestinal diarrhea. Large volume of the stool will be formed in case of small intestinal diarrhea, less volume of the stool will be formed in case of a large intestinal diarrhea. Rest of the things like abdominal pain is there, abdominal distension is there, these things are normal. Again, in the small intestinal diarrhea, we have divided it into acute and as well as chronic. So these are some of the basics. Now we go further. Now there is another term called as parenteral diarrhea. Parenteral diarrhea. It's also called a parenteral. Enteral means intestine. Okay. Parenteral. That means par. Intestine को छोड़ के बाकी कहीं से अगर कोई प्रॉब्लम है तो भी डायरिया हो सकता है. So what we are discussing so far is diarrhea is most of the time related to GIT tract, isn't it? So predominantly the disease of the GIT, especially small intestine and large intestine. But sometimes, although there is no any problem in the large intestine or small intestine, still diarrhea can occur. Patient is having some other problem in some other part of the body. For example, patient is having meningitis. Patient is having pneumonia. Patient is having UTI. Still patient may develop diarrhea. Okay, cause is out of the enteral region, parenteral. Therefore, it is called as parenteral diarrhea. So, what do you mean by parenteral diarrhea? This is occurred due to infections other than GIT. Like child is suffering from otitis media, ear infection. Child is suffering from UTI. Child is suffering from meningitis, pneumonia, etc. But still that child also can develop diarrhea. Now question comes, how? Isn't it? There is no damage to the mucous membrane, or there is no problem in the small or large intestine. Why? Because this actually because of due to the toxins which is released by these bacteria. Now usually those bacterial infections causing above problem, bacterial meningitis, okay, bacterial otitis media, then bacterial UTI or meningitis bacterial pneumonias, okay. So actually these bacteria will known to release the toxins. Now virus will going to release different chemicals. Bacteria will going to release the toxins, and these toxins are released into the blood, and in the blood it is going down, okay, is circulating. So now they release the toxins, and this toxin can reach any part of the body. Okay, so when it reaches the intestinal part, although the problem is not in the intestine, because of these toxins, there may be diarrhea. This toxin enter into the small intestine, and that toxins will damage that particular local area of the small intestine and cause diarrhea. Okay, patient is actually having pneumonia because of bacteria. That bacteria is releasing some toxins. That toxin is circulating in the blood, coming to the intestinal area, damaging the intestinal mucosa and causing a diarrhea. So although patient is having pneumonia, the patient may also have diarrhea. So such a type of diarrheas are called as parenteral diarrhea. This is also common. Okay, so actually this can happen in any age by any infection, but generally younger the child, there will be quick spread of the toxins in the blood. So this type of pathology, whenever there is a bacterial infection takes place, it can happen. Suppose simply a bacterial superficial infections, sometime when it happens, like carbuncles, furuncles, carbuncles, or abscess, etc. So even they may also lead to this type of presentation. But or at any age this can happen. But the problem is more in children. Okay, problem is more in children, as they spread very quickly in children compared to the adults. Usually infants will have this problem. So usually one more problem is child suffering from UTI. Okay, many times child will have diarrhea, and we are keep on going treating the diarrhea itself, because many times UTI is presented without any symptoms. Okay, so one of the most common cause of unlocalized fever, child is only having fever, the most common cause is pyelonephritis. Okay, so most of the time these UTIs are not understood properly, and one of the symptoms, that is diarrhea produced because of this bacterial UTI, may lead to diarrhea, and physician keep on treating the diarrhea only. We are not treating the root cause anyway. Okay, so UTI is the most common, that's what I told. UTI is the most common in children. First there will be diarrhea, then the UTI is picked up the next. Okay, so this is very important. So therefore diarrhea of the children should be looked for these two things, the three things. You have to see whether it is intestinal diarrhea, whether it is large intestinal diarrhea, small intestinal diarrhea. If it is small intestinal, you have to see whether it is acute diarrhea or whether it is a chronic diarrhea. If it is large intestinal, then you have to see whether it is associated with the tenesmus or not associated with the tenesmus. दो हो गया. तीसरा, you have to look into the parenteral diarrhea. Okay, these three things we should not miss whenever a patient comes to you with the diarrhea. Okay, now further comes, you have to see whether it is infectious diarrhea or non-infectious diarrhea. We will see it one by one. Okay. Now, how you will differentiate the diarrhea of small intestine? Of course, this may be a little repetition, but still we'll go for that. Okay, so small intestinal diarrhea is characterized by the large stool with a lot of secretions, and it is always a loose watery stool. Okay, the reason I have already explained. Normally, small intestine absorbs a lot of things. So when it is not able to absorb, the watery part and food part comes out as diarrhea. Okay, so diarrhea occurs only if the mucous membrane is involved. Now that is also a very important thing. Okay, when there is a diarrhea, suppose muscle layer of the intestine is getting involved, then there will not be any diarrhea. Diarrhea will be seen only when the innermost layer, that is mucous membrane of the intestine, is get involved, then there will be diarrhea. Okay, then there will be diarrhea. I will give an example. For example, you take the typhoid fever. Okay, We know that Peyer's patches are involved. Typhoid is one of the small intestinal disease, basically. Okay. If you see in the typhoid fever, in the initial part, there is no diarrhea. Okay, there is no diarrhea because that is localized. Diarrhea is localized to the ileum portion. That is involvement of the submucosal layer will be there, not the mucosal layer is involved. Okay, Peyer's patches are involved. So in the thickness of the ileum. Again, in case of tuberculosis, also one of the intestinal tuberculosis, suppose you talk about intestinal tuberculosis is also basically a small intestinal disease. Okay, but there is no diarrhea because there is no involvement of the mucous membrane, there is only involvement of the submucous layer. Similarly, in case of typhoid, initially there is involvement of the thick part of the ileum, that is Peyer's patches. The mucous membrane is not much affected. Of course, in the typhoid, in the later part, there may be involvement of the mucous membrane also. Then maybe in the second week or third week, usually diarrhea starts. So what I mean to say is diarrhea is majorly seen whenever there is involvement of the mucous membrane. Now this amoebiasis or colitis, etc. conditions, or celiac disease or some other gastroenteritis, basically the outermost layer, the innermost layer, which contains all the blood circulation and so many secretions, etc., which produces so many enzymes. Okay, so that will be get affected. Okay, that will be get damaged. Then there will be diarrhea. This is another basic thing. Now the same thing, how to differentiate the diarrhea of small intestine. In acute small intestinal diarrhea, yes, already I told, water and the lactose are not absorbed and hence there will be dehydration and the anal excoriation. Now this is basic thing. Now these all the enzymes which actually responsible for digestion of this glucose like sucrose, fructose, lactose, galactose, etc. So they are actually produced from the superficial layer of the mucous membrane. In the mucous membrane also lactase, etc. is produced from the superficial most layer. Okay. So now when there is damage to this mucous membrane area, superficial mucous membrane area, in case of any acute problems like infection, etc., what happens? The water is not get absorbed because mucous membrane is damaged, and lactose is not produced because lactose is produced from the most superficial layer of the mucous membrane. So that is all, that is damaged means lactose is not produced. That means, sorry, lactase is not produced, so lactose is not get absorbed. Okay, lactose is a sugar, we know that it is an osmotic laxative. So there will be lot of glucose is passing, lot of secretions are passing out, lot of electrolytes are passing out, and as a result there will be dehydration, and also the glucose is passing through the small intestine and it's now coming to the large intestine. When this glucose comes to the large intestine area, in the large intestine we have got so many bacteria. So bacteria will going to ferment this glucose, and as a result reducing substances are formed. These reducing substances are passes through the stool, and when it reaches the anal area, the soft anal area is get affected and there will be anal excoriation. So this is very typically seen in case of acute small intestinal diarrhea. Now one more point is added for the acute small intestinal diarrhea. Electrolyte imbalance is there, dehydration will be there, but there is also anal excoriation. Why this anal excoriation is occurring? Because sugar is not completely get absorbed. Lactase, which has to be produced from the superficial most layer of the mucous membrane, is not produced because of the damage, and as a result lactose remains there, it passing through the small intestine into the large intestine. When it comes to the large intestine, the bacteria are there, that bacteria ferment it, and as a result reducing substances and acidic substances are formed. When that acidic substances passing through the anal area, it affects the soft skin of the anal area and the child will have anal excoriation. Okay, so this is how the acute small intestinal diarrhea will have. Similarly, chronic, we have already explained, chronic small intestinal diarrhea is referred as malabsorption. Whenever there is a small intestine means for the purpose of absorption. Okay, chronically absorption is affected since so many years or months together, and definitely there is no protein, there is no carbohydrate, there is no protein, no microminerals, no vitamins, so child will slowly develop into the malabsorption. So malabsorption is a very typical. Okay, if mother is coming and telling since last 4 months he is having the problem and child is also malabsorption, malabsorbed and also loss of weight is there, as we seen in case of celiac disease. So definitely it is a chronic small intestinal problem, chronic small intestinal diarrhea. Okay, now type of the stool and deficiency strain suggest what is not absorbed. Now this is very important. Now without doing any investigation, we can identify where actually the problem is there in the malabsorption, whether proteins are not absorbed, whether fat is not absorbed, or sometimes the problems may be isolated. Isolated protein absorption may not be there, isolated fat molecule absorption may not be there, or isolated carbohydrate absorption or glucose absorption may not be there. But if you are an intelligent physician, you can identify just by asking an examination only. There is no need of any investigation. That we will see. Okay. Okay, now suppose if the problem is there with the protein metabolism, protein absorption, proteins, amino acids are not absorbed properly, then usually the complaint of the child is a child will have recurrent infections. Okay, and child will have all the malabsorption syndromes. And if the fat absorption is improper, then we will have loss of weight. Okay, if the carbohydrate absorption is improper, then we will have anal excoriation. So this point we will see. Now we come to the next point. Small intestinal diarrhea we have seen how to differentiate. Now differentiate the diarrhea of large intestine. As we know that in the large intestine, a small amount of the stool is formed. There will be painful defecation will be there, and tenesmus will be there, and mucus and blood mixed stool will be passed. Okay, as we have seen in case of amoebiasis, bacillary dysentery, colitis, etc. Small intestine does not absorb the glucose, so it comes to the large intestine. This is what I already explained. In the large intestine, it reacts with many bacteria and undergoes the fermentation, and there is a lot of gas and lot of acids are produced. Now, if it is basically a large intestinal diarrhea, then what happens? There will be a lot of gas and lot of acids are produced. That means not large intestinal diarrhea. If in the small intestine, if the glucose is not get absorbed, it passes through the large intestine. Glucose has to be absorbed in the small intestine. But sometimes, if you are overloading with the glucose, or if there is any problem, that glucose may pass through and enter into the large intestine. As soon as it enter into the large intestine, the bacteria react with that, and there will be a formation of there will be a fermentation. After the fermentation, there is formation of the acidic substances, and also there is formation of the gas. So patient is now supposed to pass lot of gas, flatus along with the stool. Okay, so when patient is passing lot of stool, patient is passing stool with the flatus. Amount is less, but flatus is more. That clearly suggests that the glucose what you are taking, it is not absorbed in the small intestine. It reaches the the large intestinal area, and there is a formation of the gas. Okay, so now if there is a problem in the distal ileum, okay, ileum, last part of the small intestine, okay, very close to the large intestine. Okay, now if there is a problem in the distal part of the ileum, that's what I told previously, B12 absorption will be affected. Now B12 absorption will be taking place from the last part of the ileum. Okay, last part of the distal most part of the ileum, which is very very near to large intestine. Ileum के बाद सीकम है, सीकम के बाद large intestine शुरू हो जाएगा. So B12 absorption will be problem, and B12 symptoms, deficiency symptoms will be there, like anemias, megaloblastic anemias, and knuckles pigmentation, etc. may be there, and so many other problems. Secondary anemias will be there. So one is from the large intestine, large amount of the water is get absorbed. Second one is from the large intestine, we can also take some amount of the B12 is also get absorbed. And third one is from the large intestine, as I told earlier, some of the short chain, not long chain fatty acids, short chain fatty acids are also get absorbed. Short chain fatty acids. So these are the only three functions as far as absorption of the food materials considered in the large intestine. Okay. So now if I observe too much of secretion is coming out, or the secretions continue to come, then difficult to maintain the hydration, as in case of cholera, rotaviral diarrhea, etc. It leads to secretory diarrhea. Okay, now this is another part actually. You don't confuse. Large intestine we are over. Now you know that too much of secretion is coming out. Secretions are continuing and difficult to maintain the dehydration or maintain the hydration, as occur in case of cholera. Okay, so and rotaviral diarrhea. So they are basically the problem in the small intestine. And in the small intestine, the things are not well absorbed. They are coming as it is. But glucose-like materials, when come to the large intestine, they undergo fermentation, leads to so many other problems. So this is what actually happens in case of cholera and rotaviral diarrhea. Okay, rotaviral diarrhea and cholera, etc. So now if you look into the major difference, again, in the small intestine, the stools are large with the secretions, large in volume, and there will be frequent stool, and it may be with the fever if it is infective, or it may not be with the fever if it is non-infective. The most common causes of a small intestinal diarrhea is giardiasis, rotaviral diarrheas. Okay, so you can witness all these things in the rotaviral diarrheas and giardiasis. Whereas in case of large intestine, there will be less amount of the stool is formed with the more frequency, and there will be straining with the tenesmus, what we say pravahika, which is mixed with the stool, mucus and the blood. Dysentery will be there. The different types of the colitis, amoebic colitis, bacillary colitis, dysenteries, etc. and different types of dysenteries are the best example for the large intestinal diarrhea. Large intestinal diarrhea. So diarrhea with the involvement of the both small intestine and large. Sometimes there may be diarrhea with the involvement of both large intestine and small intestine. Okay. Now this is very interesting. Okay, large intestine will be involved, small intestine will be involved. So usually such cases are considered under the inflammatory bowel disorders. Crohn's disease है, ठीक है, so many ulcerative colitis है, Crohn's disease है. So there are inflammatory bowel disorders, comes under the category of inflammatory bowel disorders, and that leads to malabsorption, and the child will having failure to thrive, loss of weight, and deficiency syndromes, etc. Symptoms, etc. Okay, so these are some of the major difference.